presentation. So I don't want to wait too long before starting in earnest. For those that have joined who are not on camera, feel free to stay off camera. That's absolutely fine. Thank you so much for taking the time to join us for this session. I know it's a gorgeous evening up in Morecambe. I'm guessing that given the range of invites that went out, there might be people down in Blackpool Way, possibly in East Lancs, possibly even up in Barrow Way on the call. I'm not going to ask those on the call to sort of say where they are. We're going to run through a presentation. And please feel free, if you've got the chat function, to put questions in the chat. If I'm in sort of full flow, I might want someone to alert me to the fact there's a question in the chat. Equally, if you've got the hands up function, you can raise your hand and we'll come to it. There will be time at the end for questions. The reason we're doing this is because my name is Ian Hook and I lead the careers team at Morecambe Bay Trust. And when we go to schools for various kinds of engagements, whether it be open evenings or careers fairs, parents quite often are really not that well informed about T-levels, and because they are very new, and so we thought it'd be a really good idea to try and get a session where we can spill the tea on the T-levels at tea time. So there is quite a lot of there will be quite a lot of information, but hopefully we'll cover everything that's important. So I'm gonna crack on. We've got other colleagues on the call from Association of Colleges, from the colleges themselves in the area. We've got some T-level students who are going to give some testimony later as well. We've got representation from some of the local colleges, yeah, so there's a nice mix of people on here. And this is being recorded, so we can be sharing it later. So what we're going to cover what T-levels are, the difference between a T-level and more traditional routes, what you'll learn on a health T-level and how you'll be assessed, what are industry-based placements, what are the benefits of undertaking a T-level, what are the entry requirements, what if I want this option but I don't have the correct grades, where could I do a T-level or where could a T-level lead, some testimonies, and then time for questions at the end. I would say that although we are advocates of T-levels, we're not saying that A-levels or other routes aren't equally good. They are equally good, and A-levels offer a fantastic option, but people tend to know what A-levels offer and know where A-levels can take you. I think there's perhaps some information sharing required around T-levels. So certainly if you're anywhere like my generation, I'm probably one of the oldest ones on this call, when it's relatively recent that you can't just leave school at 16 and get a job. That's not an option anymore. You can leave school at 16 and get an apprenticeship. That is an option because that is still education, but you have to remain in education until you're 18 these days. So there's basically three options when you finish school after GCSEs. You could do A-levels at a local college or local school. If you're lucky enough to have an apprenticeship opportunity at 16 and go and work and earn money at the same time, then you can do that because you're still studying. But then the other option is a vocational qualification, and some of you may have heard of BTECs or NVQs. Now T-levels are kind of taking over that provision. BTEC still exists, NVQ still exists to a certain extent, but BTECs are this relatively new technical qualification, and the T stands for technical. It's a 2-year course. You can undertake it at local colleges and some schools. The vast majority of T-levels are delivered at colleges rather than schools, but there are some schools delivering. And it's 80% classroom based and 20% on a placement, so a significant number of placement hours. And one of the key things to understand is that you only do one T-level, and you don't do a T-level alongside A-levels. You do a T-level, and we'll come to how that impacts on progression and on UCAS points a little bit further in the presentation. So essentially it's the technical qualification that you can do, and you just choose one T-level to study from the ages of 16 to 18, or if you take a year out or you've deferred, maybe 17 to 19. At the moment you actually have to be 19 or under to commence a T-level. After you've done those various routes, there are, of course, higher education is a possibility after all of those 3 routes, going into skilled employment or perhaps going on to a high-level apprenticeship. And all 3 of those progression opportunities are available for all 3 of these pathways above. So what does the T-level involve? It's got a core component, so core theory. So if it's a health T-level, then the core learning will be around that health focus. And there's a focus on the essential knowledge and understanding and the skills required in that area. You'll have 2 written exams, and college colleagues, if any of this is out of date or I'm getting it wrong, please just intervene. 2 written exams, externally assessed, so just like an A-level would be or a GCSE, and there's an employer set project as well, which is externally assessed, so like a bit like an EPQ, I suppose, but kind of an extended project that that the students will undertake. Occupational specialisms in the health T-level. Now, you'll come across this, and I want to make something really clear about this. So if you do a health T-level, the college chooses, yes, the slides will go out on an email, absolutely. The college makes that decision about which of the specialisms they are going to offer. The student doesn't get to choose the specialism in midwifery because the college has to offer it. And all 3 colleges I work with, Lancaster and Kendal and Furness up in Barrow, they've all chosen to do the adult nursing pathway. But colleges could choose midwifery, therapies, mental health, children's and dental. Now that'll depend on the skill set of their staff and the ability of their staff to deliver those specialisms. But what I really, really want to emphasize is that universities completely ignore that specialism when it comes to university entrance. If a university, and many, many do, if the universities accept a health T-level as a qualification for their undergraduate course, they never specify what that specialism is. That specialism really comes down to the college's ability to deliver it and the students getting a bit of extra input. It might be that if a college chooses to do a midwifery specialism health T-level, that those students' placements might be in the main in midwifery. But please don't worry if your child wants to pursue a career in midwifery, but the college is offering the adult nursing specialism. We have demonstrable evidence of students going on to midwifery having done the adult nursing pathway. In fact, we'll talk about those pathways in a moment. One thing I should say as well is that there is now a university down in the south of England, Anglia Ruskin University, which now accepts the health T-level for medicine. So it's the very first university in the country to do that. So if you have a child who is wanting to pursue medicine, they can do a health T-level and pursue medicine at Anglia Ruskin. We know that there are universities nationwide that will offer that accept the health T-level for virtually every health-related undergraduate course, whether it be radiography or midwifery or speech and language therapy, so that there's no restrictions there. Industry placement, 315 days, which is about 9 weeks, and this could be done in any number of ways depending on the employer and the arrangement with the college. We do 3 blocks of 3 weeks. Blackpool do a long stretch of about 15 weeks, doing 1 or 2 days a week. It will very much depend on your local offer, but it equates to about 9 weeks in total, 315 days of placement. Or 45 days, thank you, Peter, yeah. And the weekly timetable will be normally 4 to 5 days. So it's a full-time course in that respect. Now, this is, I think, an interesting one. And Sam, I wonder if you're available just to sort of talk through this a little bit, because this is kind of your expertise in respect of the gradings and how T-levels are graded.
Yes, so hello, my name's Sam McKenna. I'm the Director of Health and Social Care at Preston College. So the T-level is graded as one final outcome. So you'll see there the table says pass, merit and distinction. So the final grade that you'll get is there, and you've got the opportunity to get distinction star as well. However, the 2 years are graded separately. So year 1, which encompasses the core component 2 exams and the ESP, the employer set project, are graded A star to C. A star to E, sorry. So you get a grade at the end of your year 1 component, and then at the end of year 2, your occupational specialism is graded pass, merit and distinction. And those 2 grades are put together to come out with your final grade there. So your final grade is based on the average of what you get there. So if you can see from the table there, if you get a C overall in your core component and a merit, a distinction from your occupational specialism, then you achieve a merit overall, and likewise there.
Thanks, Sam. That's really helpful. And this is the bit that I think some parents are worried about, is that the UCAS points and getting the grades that would be required for entry into an undergraduate course. And you can see here the direct correlation between the UCAS tariff points and the equivalent A-level results and the equivalency for the T-level grade. So a distinction star at T-level is the equivalent of I don't know if that's 3 A stars or AA and A star in terms of UCAS points. 3 A's is the same as a distinction in a T level, and so on and so on. So there is a direct correlation there between the UCAS points that you can gain based on your T level grade, and you can see how that matches with the A level entry. And the universities still have to accept a T level as a qualification, but the UCAS points give it that weight and that robustness, and more and more and more universities are now accepting the T level as an entry criteria for undergraduate courses. Bit of a wordy slide this, but this is the industry-based placement. Now, it's a minimum of 315 hours over the 2 years, so it can be spread out however the college and the employer wants. Generally, you see, well, that's not true actually. Some NHS providers, employers and colleges actually don't send their students out in first year at all. Some just wait for their second year for the placements. 2 of the colleges I work with, one of them sends their first years out on 2 placements and their second years out on 1, and the other do 1 placement in first year and 2 in second year. So there's no set pattern for it, and it is very much decided between the college and the employer as to how those placements work, and it'll depend on how the employer can facilitate it and accommodate it, and it'll depend on a certain extent on how the college's timetable works. But in essence, over those 2 years, you will do those 45 days or 315 hours, 9 weeks almost. It might be a block, it might be day release, it might be a combination of both. And again, that's down to the college and the employer. It must be meaningful work to demonstrate threshold competence in the chosen occupational specialism. So, that the experiences will differ from employer to employer, but certainly within the locality, if you're doing a health T level, the employers in our area, so Morecambe Bay and Preston and Blackpool, they provide and of course Caroline Clifton Home Care as well in the social care sector, provide substantial and robust training prior to coming on placement, moving and handling training, mandatory training that all staff have to do. They go through full occupational health clearances and this kind of thing, which means they are able to be fully involved in the work that happens within the health and social care sector. So they do get hands-on with the patients. They do get involved and stuck in as much as a clinical support worker or a healthcare assistant would do. Obviously, they're not trained clinically, so there are limitations of what they can do with the patients, but it is meaningful work. Over the course of the 2 years, at the moment, T-level students can only be placed with 2 employers. So it's not like they can go and travel around the area and do a placement in a social care setting, and then with the ambulance service, and then at a trust, and then with a mental health provider. Maximum of 2, and generally with the health T-level students, they will do placements in a hospital trust local to them, and possibly a placement in social care as well. Uniform might be required, dependent on the route, and that could incur a cost. I do know that some colleges do pass on that cost to the students. Not all do, but that's something you'd have to sort of find out from the colleges as and when that happens. Colleges will place learners with pre-checked and suitable employers. So yes, the relationships between the colleges and the employers in the area is really robust. We've got a working group. We've been meeting for about 4 years now. We meet every month as a collaborative, all the colleges and all the local employers who support the health T levels. We meet and we talk about how we can improve our offer. And actually, this is where that's where this webinar came out from. Every college will have a designated industry-based placement coordinator, and the employers will have one as well. Abby Dow on the call is our placement coordinator for Morecambe Bay, and each of the colleges will have staff that look after that placement coordination. Most health placements will require DBS clearance before placement can take place. That's the same for any member of staff working on in a clinical site. And all learners will be visited in their workplace setting and will have a designated contact at college and at the employer. So the idea is that when they're out on placement, they won't just be left to their own devices. They'll get visits from the college and visits from colleagues like myself who are in charge of that offer. So the benefits, they get to see a real working environment, massively important. Most placements are based on kind of full-time work. You do the standard shifts that you would expect to see in a healthcare setting. You get simulator settings in colleges. So all the 3 colleges I'm aware of have fantastic skills labs, essentially real wards mocked up on their premises within the college environment, where they have proper hospital beds and mannequins and really fantastic resources where there can be kind of clinical skills taught within the college outside of the actual outside of the employment setting as well. Opportunities to meet and work with a range of employers during the course of the programme. And what I'd say about that is, yes, it's only 2 employers, but if they do 3 placements over 2 years, one might be with physiotherapy, one might be in ED, and one might be on the children's ward. So they're going to encounter a huge amount of different professionals during that time. Support to make informed decisions about your next steps. So there'll be the colleges and careers teams within the employers will be able to really help them and inform them. We always say to the students that we look after, that support for those next steps is always there, and as a careers team we'd reach out and say, if you want help with applications, help with interview prep, that's all there, which I know the college will offer as well. Developing those employability skills, ensuring high levels of employability upon completion. The students are eminently employable. What we do find is a lot of the students do go onto university and undertake undergraduate courses. The ones that I know of who have sought employment have got it like that, because they are so experienced within, and so if they've gone for a nurse associate apprenticeship or a clinical support worker role, the experience they've gained has meant that they have secured that employment very, very easily. And they're qualified for all health-related undergraduate courses, including medicine. So I'm not saying that every university will accept a T level, but there is a university somewhere in the country that will accept a T level for every health-related undergraduate course, and that includes medicine. The entry criteria is college dependent. It will differ from college to college, but the basic standards will probably be something like grade 4 or higher at both maths and English GCSE, and possibly a science as well, and a total of at least 5 GCSEs with grade 4 or higher. You might find your local college asks for grade 5 because they want to make it a bit more competitive. It will differ from college to college. And I think this is really important, because if you don't get the grades, most colleges I know of offer what is almost kind of like a foundation level. So if you really want to pursue that T level, but you don't get your English and maths, and so therefore can't get on it straight away, a lot of colleges offer this 1-year kind of foundation course, where the first year you complete your missing GCSE requirements, the English and maths, and you develop industry skills and knowledge and readiness for a T-level, and you may even get a short placement during that time. You gain some recognised level 2 qualifications, and you might, as I say, undertake an industry-based placement, and that will give you a really good foundation for starting that T-level proper in years 2 and 3, where you just join the cohort who are doing their T-level over 2 years. Right, enough of me talking. This is a little video which I like to share because these are students who have undertaken the T-level. We've gone out to visit them on placement, and they are talking about the support that they have received from colleagues within the employer's environment. And for any parents watching, it's like it maybe is a kind of a reassurance that the students have had a fantastically supportive time. So this was produced for what we call T-Level Thursday back in February. It's only about 2 or 3 minutes long. I think there's someone not on mute. I'm not sure. I'm hearing something in the background, but not to worry.
Sorry, yes.
No worries. Thank you very much. So this little video is it's only a couple of minutes long. It's not even 2 minutes, but it's a lovely bit of testimony from students whilst out on placement.
All been amazing. They have been so supportive. They've told me everything that I need to know and gone above and beyond with absolutely everything. They've been amazing.
Oh, amazing. They've been great. They've been really lovely. Like, within the first 2 minutes, I felt comfortable.
It's been great. I've really enjoyed it. They've answered like all the questions I've asked them, and they've been really supportive.
The staff have been very good with me. They've been really welcoming, and they've been quite helpful in explaining what's going on and what to expect, but also like helping me understand how to negotiate the building and where to go for food, and quite just really nice with me.
Yeah. They've all been absolutely lovely. They've helped me out wherever they can. They're very patient, obviously, because of the odd thing I don't know how to do, but yeah, everyone's been very nice and supportive.
My mentors have been great. This is my second time on the ward and I couldn't be happier.
They've been really good. They're all really nice.
Yeah, really nice and supportive.
Yeah,
of everything.
Been dead welcoming. They'd help me with everything and not mark that on.
Yeah, really good. Any questions and worries or things you're curious about, they'll all answer fully.
Really good. They were all really welcoming when we first arrived, so I think that made it a bit easier to start the placement in like a new place. So.
Yeah, they're all quite supportive, and they're all want us to get involved with everything, so they all ask us to do activities and stuff.
Oh, they're really supportive. They're funny and they want you to participate as much as you can.
So I think for me that just offers maybe a level of reassurance, and you might recognise Phoebe and Ellie, who are on this call right now. I saw Phoebe hiding her face when she realised she was on screen, so sorry Phoebe, I should give you some warning about that. And what that does highlight as well is the range of placement opportunities within the hospital. If you notice where they were placed, theatres, ED, midwifery, gynecology, pathology, speech and language, it would be hard to name a department within the hospital where students have not been placed. The one I can think of is mortuary, and we've had mortuary requested a couple of times, but we're not putting students in mortuary at the moment. But everywhere else they're allowed to go, and we're really proud of that actually, because it really does open up those opportunities for them. So we've now got some testimonies. You've heard from me enough, and I will give an NHS testimony in terms of what we have, how we have benefited from hosting T-levels. But I'm going to pass over first of all to Caroline Kosh, who is here representing social care, to give a testimony of her experience of hosting T-levels and how it's benefited her own business. So I'll hand over to you, Caroline. Thank you.
Thanks, Ian, and thanks to everybody for joining us. So I'll just give you a little bit of my background, because I think that's really pertinent to what I'm about to say. So I own and manage, I'm the Care Quality Commission, so the CQC Registered Manager for Clifton Home Care, and we're a home care business based in St Anne's. but I wear a health hat as well. I'm also a HCPC registered paramedic, and I've got 20 years experience frontline. And we've been supporting T-level students for about 3 to 4 years now, since they started. And we support Blackpool Vale College, and we now support the sixth form college at Blackpool. When students come on board with us, they have a 2-day induction, and then they go out, they get paired with one of our experienced team members. So they get that one-to-one support. And what we find is it prepares students really nicely before they go into the NHS, where they're on a ward base, because they get the one-to-one support. They support them with communicating with a wide range of people with dementia, people with an acquired brain injury, family members, etc. And that really does seem to set them up really well for the NHS placements. It's still disappointing that people often are allocated a placement in social care, and I'm not entirely sure the majority of people see the value of that. And I think social care is sometimes undervalued, but the students we get all provide fantastic feedback about the experiences that they've had. And that goes back to that one-to-one support, but the wide range of activities that they get to see and support. And that's why I told you I was a paramedic, because I very much feel the home care role is a basic version of a paramedic. We are going into people's own homes. We're using our senses from the minute we put a key in a front door. And we are working with a wide range of healthcare professionals in the community setting. And that could be a physio or the falls team. It could be the SALT team if somebody's got a speech and language problem. Or it could be somebody that receives peg feeding because they are nil by mouth for whatever condition. And I think I want to say, social care provides such complex care for people now. People are living much longer with multiple conditions at any one time. I would like to say that the students we've had, from the students that we've had, we have employed, I think, 4 to date on a part-time basis, and 1 student has been with us for pretty much the 2 years. Her other placement didn't quite work out for reasons which are not really relevant today, but she came back to us, and that's happened before as well. So she now works her placement hours and gets paid for that. So she is incredibly happy about that situation, really, because she's earning whilst learning. So we have, in terms of how it's helped our business, we have as a result of it, and I think it really helps prepare people so that they understand what the social care sector is for whatever role they go on to in later life, whether that be a paramedic or a nurse, etc. So that's me, Ian. I don't know if you wanted me to say any more, but I'm just conscious of time.
That really valuable, Caroline. Thank you so much. And I'm really glad you mentioned those employment prospects as well. When I do my bit about testimony from NHS point of view, I'll touch on that as well. But I'm going to bring in Sam from the college perspective. And although Sam is representing a college, we're kind of wanting to have a kind of generic view, aren't we, about that offer. So thank you, Sam.
You're welcome, Ian. Thanks for inviting me along. So from a college's perspective, we've run T-levels for 3 or 4 years now, and we've seen the opportunities for students. They're absolutely massive. There's the opportunities to develop skills and behaviours and knowledge about the sector and make real choices about career pathways is just an absolute opportunity. At our college, we still currently run a BTEC and a T-level provision, but you can see the skill development and confidence in our T-level learners in comparison to our BTEC students. They are far more advanced than our BTEC students in that confidence and the ability to walk into those jobs afterwards, whether that is straight into a nursing degree or into an apprenticeship or straight into employment. They've got those skills, they're work ready, they really are. the amount of the knowledge base is very similar to a BTEC in the sense of the core components of health, but there's a big focus on science that students do need for those nursing careers that they will need to cover on an undergraduate degree or on a degree apprenticeship. So they're really getting ready for what the next step is, but there's also underpinning their skills that are going to be developed in the workplace as well. The difference with that, so there's that academic core where they sit the 2 exams, and it's a little bit like an A-level, so they're testing those kind of academic skills ready for that next step and to check that knowledge. But the employer set project and the occupational specialism assessments that take place over the year 1 and year 2 really focus on the skills enhancement of those individuals, and it's so great to see some of the activities that they get to go on. So they're in the college, in the hospital wings in the colleges, they'll have to work with patients and deal with things like a nurse might deal with that they're not able to do on the actual ward, and they're actually videoed and assessed externally on the skills, their patient-centered care, how they communicate with the patient or the pretend patient that they have to look after on these assessments, but equally on their reflection and self-assessment. So what did I do well? What would I do better? What would I do differently next time? And it's so great to see the development of an individual from when they do the ESP in year 1 to the occupational specialism in year 2, the skills and behaviours and the knowledge. They can just see the difference between those individuals, and it's so rewarding to see them come out at the other side and then make the decision to go on to whatever pathway that they go on to. From our students, just to mirror what Ian said from his colleges, we've had students go on to be adult nurses and child nurses, midwives. We've also had students go on to do paramedic sites, which is so competitive to get into at university, very competitive area, as well as physiotherapy. So there's such a broad range of skills. It's not just the nursing, the adult nursing, if that's the title of the T level that your children or the students will be undertaking. It opens the door to all of the allied health professions as well. It's a really, really good opportunity. I hope that's enough, Ian. Thank you.
That's perfect, Sam. Thank you so much. And yeah, I'm going to leave the best till last because we have got 3 students with us, India, Phoebe, and Ellie, and they are they're the reason we're doing this. And so I'm going to bring them in at the end. I'm not going to speak long at all, but from an NHS perspective, all the 5 trusts in the local area support T levels, and we're in our 4th year now of delivering, and we have found it enormously beneficial for a lot of reasons. Our staff have thoroughly enjoyed having young learners back in again, and they thoroughly enjoy the fact that the placements are for 3 weeks and they can really immerse those students into those experiences. BTECs traditionally have been much shorter placements, maybe 3, 4, 5 days, and the students come and go in a flash. Those 3-week embedded placements really, and when I visit the students, I'm always taken aback, even like sort of day 4 or 5, that they're just whizzing around the department, knowing exactly what they're doing, following instructions, being proactive, using their initiative, and it's great. In terms of, we viewed it initially as a recruitment process or a recruitment pipeline, and we always encourage the students to, in their 2nd year, to start doing what we call bank shifts. So if you're not familiar with the term bank, it's a bit like a supply teacher, but within the health sector. So you can pick up shifts as and when you want. And so we encourage our students to apply for the bank CSW, the clinical support worker roles, and some have taken us up on that. We do have a nurse apprenticeship pathway, which the T-level students are encouraged to apply for, which means they can do a 2-year nurse associate apprenticeship with the possibility of then doing a 2-year top-up to the nurse degree. We've had 1 student take us up on that offer, and she's currently in her 2nd year now of her nurse associate apprenticeship. But the vast majority, we've discovered, do want to pursue an undergraduate qualification, and of course we would love them to stay with us, but equally we want them to stay within the health and social sector. So if they go off to do paramedic science, or they go off to do children's nursing or adult nursing or physiotherapy or radiography, all those ones we have, and midwifery, they will end up working back within the health and social care system. If they're physios, they may well end up working in the social care sector as well. So although we would love to retain them locally within our trust because we've supported them, we understand that, you know, young people want to spread their wings, and if we can support them into those undergraduate pathways, that's great. We have got T-level students who have graduated 2 years ago, sorry, a year ago, just like, well, yeah, 2 years ago, who are now doing their undergraduate placements back with us, which is lovely. We've got a midwifery student who's doing her placements with us at the moment, the RLI, and a radiography undergraduate who's doing their placement. So we really value it as an opportunity to grow our own, to be an employer of choice in the area. You know, we want to be that employer of choice. We want to be an anchor employer, and have young learners understand that, you know, there are opportunities within that health and social care sector. And we have worked collaboratively with local social care providers. Caroline isn't in our localities, has not worked with Caroline, but we've worked with a care home up in Furness, up in Barrow, and we've kind of ensured that there's been equity of offer there in terms of students doing a placement in social care and a placement with ourselves, and then choosing what their final placement is going to be. So we're trying to keep that kind of holistic health and social care approach and not just have it health focus as well. But it's a program and a project that we are very proud of in our area, and we also know that colleagues like myself who deliver the T-levels within their own trust in their area really value the program as well. But I did say that the most important people here are India, Phoebe and Ellie, because they are 3 students who have pretty much completed their T-level now, and we asked them to come on here and give a 1-2 minute testimony each around their experiences. They're not prepped for this at all. I shouldn't be nervous at all about what they're going to say because they're all wonderful, but I've no idea what they're going to say. So it'll be honest, it'll be from the heart. I'm gonna choose rather than ask anyone to come forward. I'm gonna just go along the line, and the first one in line for me is India. So India, could you maybe just give a little bit of feedback, please, about your experience of doing the T-level? Thank you.
Yeah, no problem. I wrote a little bit down about kind of where I've been and like what I've done. So my placements have ranged from the first year to the second year. My first placement was in a community care, so a rapid response team, which is more like community nursing in Kendal, and that's ranged like wards in Barrow, such as surgical wards and medical wards. So I've had like being out of the hospital, and I've been in the hospital. I've also done a placement in Kendal ICU. So intense care unit. And this has just given me such a range of skills that's prepared me to go to uni, to be able to get my degree in nursing, because I've been able to explain to the unis, like, I've done personal care, like I've been taught how to feed patients, I've been taught how to do personal care for patients, helping wash and kind of clean patients, just basic skills that they need. And I just think T-level is so great at making you stand out from like any BTEC courses, because we're doing stuff that maybe the BTEC course hasn't done. Again, such as the skills with the patients, and also just learning communication techniques. So looking at different types of patients, such as patients maybe with speech impediments, and seeing different ways to speak to these patients. It just makes you go into university with such a confidence, because you are kind of, you have such a good understanding of what to expect.
Yeah, that's fantastic. And India, can you just share with those on the call what you are planning on doing next?
Yeah, so I've been accepted to go do my bachelor's degree in adult nursing at Newcastle University.
Fantastic, congratulations, that's brilliant. Really well done. Brilliant. And I've just answered a question in the chat there from one of the people on the call about paramedic training. So upon completion of the T level, they can absolutely apply directly onto the paramedic science undergraduate course. Oh, there's someone else put in there as well. Caroline as well. Rising. Oh yes, thank you, Caroline. Absolutely.
Yeah, sorry, should have said that. One of our T-level students won the Rising Star Award last year.
Yes.
And also, I teach a bit on the paramedic degree at UCLan, so it's just a bit in there about that might be useful.
And it's lovely. And actually, paramedic science is Oh, I'm so sorry, Caroline. I didn't realise Caroline Openshaw. I didn't realise we had an LMC student as well. We will of course go to Maiwa for her testimony as well. So I'm so sorry. That's completely my fault. I do apologise. But yeah, the first cohort that graduated from Kendal College, there were 11 that graduated. 5 went on to paramedic science, 2 adult nursing, 2 midwifery, and 2 children's nursing. And so, yeah, we know that happens. Phoebe, I'll come to you next, please, if you don't mind. Thank you.
Okay. Hi, I'm Phoebe, and I've been to 3 different placements. I've been to district nurses in Kendal, Merley Moss, and I've been to Ward 2, which also links in with day surgeries as well. But my favourite has been audiology that I've been to, and I've come back to that for my top-up placement. So on district nursing, we did like going out to patients. So it was quite like a person-centered like care, because you'd see patients and you just had to like walk in and you didn't know what you'd expect that day. So like we get different patients each day and they'd come in and we go and see them and we'd do like different tasks. So we'd see some palliative care patients. We'd also see like dressings. We'd also do like wound checks and everything, and we'd also just go out to some patients who struggled with like daily life activities. And then for Ward 2 and day surgeries, I was mostly on Ward 2. I think I went into 3 surgeries and witnessed them. But with Ward 2, it was mostly like bladder ward patients. So we'd see lots of treatments for bladder cancer and things like that. But my favourite was audiology, because I've learned quite a lot of skills from audiology, and I've realised when I've come back that I've remembered most of my skills that I've gained from it. So like today I've done some like retubing of hearing aids, because there's like 3 different types of hearing aids you can get Bahas, which are in like inside the ear and they don't have any connectors, but there's molds and slim tubes, so they're all different and they all have like different brands of hearing aids. You get more powerful ones, like less powerful ones. They all take different batteries as well. But I think my favourite part of it is probably setting them up, because I get to do that like myself, and I never thought I'd be able to do it. But I get like told on how to set them all up, and like one of the people I work with, she's called Julie. She lets me like set them up while she talks to me about it, and then it's just really good because I also get to like explain to like patients about like what a hearing aid does, like what the buttons do and everything. And I also get to like discuss test results with them, with like Julie present obviously, because I don't think I'd be able to do it on my own. But yeah, I just really enjoy like audiology the most, because it's been really fun and I've got like lots of different knowledge of it. And I also get to sometimes sit in reception at the start of it, and that includes like doing postal repairs as well, and being like independent and doing those myself. But yeah.
That's brilliant, Phoebe. And I think, what illustrates to me is, some of the students just rattle off these terms as though it's second nature now. And I'm not clinical, and I just like, what are you talking about? This is brilliant. You spend, I don't understand what the things I'm talking about, and I love that. And Phoebe, what are you doing once you've graduated?
I'm doing forensic science with criminology at Preston.
Fantastic, wonderful. Thank you, Phoebe. I'm going to come to Ellie next, if you don't mind, Ellie. Thank you.
Hi, I'm Ellie. So obviously you would have heard before on the video, I did gynecology for my first 2 placements because I loved it that much, and I got to be able to go back and do things that I couldn't do the first time, and I got to go in clinics. I even got to go in the neonatal ward for a day and things like that. And for me, that was one of the best things ever, because not only was I experiencing the things that you would normally get on a ward, but being able to go out in clinics and help out and do things that they would do individually on that clinic. And I would say at the beginning of my 2 placements, if you asked me what my favourite would have been, it would have been gynecology. But as I moved on into my second year, I changed it and I went onto the minor treatment unit at Lancaster, where I not only got to go on A&E, I got to go on the paediatrics A&E, as well, and go around the hospital and help like transfer patients, that became my favourite, because especially seeing everything on A&E and really get into how it works, and being able to sit and do A&E triage, which was my favourite bit, because that's where I got to be most practical, doing all the observations and things like that. And that's great. It's great to not only bring your confidence up with people, and if you're going to be in patient interactions and things like that, it helps you also get lots of knowledge and practice in on your clinical skills.
Amazing, Ellie. So I know, Ellie, you said you're taking a year out, but what do you think you might do after that? Any ideas?
So well, for my next year, I'm hoping to get on the bank and spend some time in our trust, and then hopefully the year after get on and do a nursing associate apprenticeship.
Amazing. So make sure you link in with Ash or Hannah, because they've got the link for the bank. Yeah, I didn't. Yeah, cool. Thank you, Ellie. And one thing I'll just say is, so Ellie touched on something that's really important. Ellie thought gynae was going to be her thing. Do you know what I mean? But because she was given different placement opportunities, she found something else that she really loved. And I think that's really important. I always liken it to when I trained as a teacher. I trained as a secondary school teacher. That's what I was going to do. I had to do a week in primary school during my training. I was dreading it. Didn't want to do a week in primary school. Got the placement sorted, was like, oh, I've got to do this. After 2 days, I switched to primary. I just loved it that much. And that for me, student might think, I don't want to work in frailty. I don't want to work in physio, but you get exposed to it and you might love it. Right, final student, last but by no means least, Mayoa. Forgive me if I said your name incorrectly, Mayoa. I do apologise. I don't think we've ever met before properly. On you go.
It's all right. Yeah, so basically my first choice was not even where I was. It was pathology, because I just felt like I liked pathology. But at the end of the day, things happen for a reason, and I was put in acute frailty. And the first time when I saw my option, I was like, I do not want to go to frailty, or I don't want to be with old people. I might not like it. That's not my passion. But literally, I'm going there next year again, because it's the best thing that's ever happened to me. Like, they were so nice. And it just like taught me a lot of things, how to be patient with people, because these people are old, and you just need to like be patient with them, because they don't really understand, and they're not like they're not fit like us who are young. And I learned like a lot of skills, technical skills, employability skills, being more caring, more compassionate. I did a lot of things as well. I cleaned beds, I made beds, I talked to patients at my free time. I learned how to use like a bedpan for patients who had urinary incontinence. And this is something I've not done before, but it's really, really important and really, really nice. And it was for 3 weeks. So I had like a lot of time to get used to the place and meet new friends, meet new people. I saw multidisciplinary teams come in, physiotherapists, occupational therapists, pharmacists, paramedics, and it's brilliant. I will go there again for my second placement, and I can't wait.
Thank you so much. And I think what you mentioned there at the end there was, meeting all the other professionals on the ward. You might have a ward placement for 3 weeks, but you're going to meet speech and language, you're going to meet physio, you're going to meet OTs, you're going to meet all these amazing colleagues. And we always encourage students to say, can I follow you for the next 3 or 4 hours? Can I follow the patient down with you and see what happens with them? And they've got license to do that, which is fantastic. Right. We've got about 10 minutes left. I just want to address the question in the chat about the mental health, because about the mental health T-level, because Peter, forgive me, I thought that was referencing the mental health pathway for the health T-level, or is there a brand new mental health T-level coming out? Peter, can I bring you in on that? If he's here. Has Peter gone?
Yep, I'm here, just trying to find the unmute button, Ian.
Sorry, I couldn't see you on my screen, mate. Sorry.
No, it's not a new program at the moment, Ian.
No, so it's one of the pathways.
Yeah.
So what I was going to put in that chat, and I don't want to speak for Nelson and Colne College, but Sarah, who's put the question in, everything you've heard today is pertinent and relevant to every health T-level. Now, your daughter is doing a health T-level with the mental health pathway. The students you've met tonight have got the adult nursing pathway. Like I said at the very start of the presentation, the pathway it's not irrelevant because it determines what they learn at college. It's irrelevant in many respects to their progression, because universities don't look at the pathway that they've taken. We've had students who have done, all our students have done the adult nursing pathway, and you've heard that massive range of undergraduate courses they've got onto. Nelson, if your daughter does the mental health pathway, those very same pathways will be there. It maybe will make it more likely for her to get onto a mental health nursing degree, possibly, because she'll have that background. She'll be able to evidence the placements. I was going to say it's possible that your daughter may not get all her placements in a mental health provider, because there are quite often restrictions around age with mental health placements. I don't want to speak for Nelson and Colne College, so I don't know what their provision is for that, but certainly we would struggle to get 9 weeks of placement in a mental health facility for our students, because age is often a barrier. But everything we've spoken about tonight has been really the health T level, and it doesn't matter what the pathway below that is. I hope that makes sense. So Sam, you run the mental health pathway alongside. Oh, okay. And yeah, and in terms of the progression of those students, have you seen anything very different, Sam?
No, so some of them actually make a decision to go a different direction, and like you say, they don't, because of their age and the limits on some of the mental health like resort like facilities and things like that. They won't always allow a 16-year-old to go in on placement. However, that's where we bring in guest speakers from those organisations to come in and deliver and explain how things work. And there's elements of mental health that they can go in and shadow, and then those clinical skills are still also needed for mental health nursing as well. So it's kind of a dual placement, if that makes sense.
And I think Sarah, if she's in psychology and doing a psychology undergraduate course, I would imagine that what she's experiencing for the T level will be, in terms of UCAS points, absolutely fine. And actually, having had some mental health placements potentially, and some and specific mental health learning from the pathway learning, that'll be massively beneficial for her. We've got just under 10 minutes, about 8 minutes left of the thing. The next part of the presentation was questions. There are parents, I think, on the call. So if anybody has got anything they'd like to ask, whilst you've got college representation, student representation, employer representation for both the NHS and social care, this is the forum where you can ask things, where there's hopefully someone who can answer anything you've got, anything that you want answered. So I'll just open the floor up. Please put it in the chat, or please put your hand up, or please just shout out. And I'll do what my boss does and leave it 30 seconds if people are just a bit nervous or wondering about whether they want to say anything or not. Fair enough. Well, I hope it's been useful. And we will share the slides. My colleague Abby has been brilliant in sending out all the information around this and setting up the registration link. So Abby will be sending out the slides, and will also upload, Abby, if this is okay. It may not be tomorrow, but Abby will upload the recording of this session to our careers website, which is the Northwest Careers website. And when she emails out again, she'll email everybody the link to watch this presentation back over again, and everybody who couldn't attend tonight will get that link. Thank you, Abby. I really appreciate that. And on the slides, we wondered about how to do this, because there are so many people you could ask questions of. There's all the colleges, there's all the different providers. I'm not suggesting that I will be able to answer all your questions, but if you email me with questions, I will be able to direct it to who I think will be able to support you best. We thought, rather than have 20 email addresses on that final slide, we'll just have me, and I will be able to direct things accordingly. Peter, you're here representing the Association of Colleges, and T levels are your heartbeat at the moment. Is there anything that we have missed that you think is vital
No,
from this evening?
the only thing I would add is if we're looking at progression from T level, I've been involved in working with Anglia Ruskin University to get door open with for T level health students to move on to the medical qualifications they've got going. So that was quite a niche kind of thing that was happening last year. Since then, Simon's come back to me. Then we've done a little bit of marketing around that, and we've got a number of other universities looking at doing the same. So they've been a real trailblazer.
Good.
Blazer. Sorry, I've not had my tea yet. They've been a real trailblazer. So I think there's going to be more and more opportunities for our T-level health students to move into medical qualifications if that's their bag and that's what they want to do. I think for you, Sarah, psychology, absolutely, there should be some opportunities coming up for that as well.
At every opportunity, when I speak to anybody from Lancaster University, I'm always saying, when are you going to learn? When are you going to have T-level in health being forgive me, I can't the word, a qualification to get onto medicine there, and they are looking at it. They are looking at it.
I made an introduction literally a couple of hours ago for Keele University.
Okay, cool.
So
very good.
Yeah, it's looking really positive at the moment.
Cool.
And I guess, as I put in the chat, I'm always impressed to hear T-level health students speak.
Aren't they amazing? I know.
You just did yourselves proud today, girls. So I wish you the very best for your futures. And it was just lovely seeing all the adults' faces smiling as you were just kind of sharing your experiences. You've got everybody behind you, I think, on this call.
Absolutely. So totally the stars of tonight. So thank you, girls, for all coming along. Really, really do appreciate it, genuinely. Right, we're done time-wise. As I say, we'll send things out. But thank you so much for joining, taking the time out of this beautiful evening. I think I've got time for a quick walk down to the prom in Morecambe before various bedtime things happen. So enjoy the rest of the evening, and we'll be in touch with links and further things. Thank you very much.
Right,
Bye.
I'll see you tomorrow, Ian.
You will. Oh, of course, yes.
Yes.
Yeah.
Right, take care, everybody. Good night.
Thanks, Sam. Thanks, Caroline. I'm Caroline Openshaw. You're disappearing now. Yeah.
You're very welcome. Very welcome.
I think it went quite nicely, didn't it? We had 60 sign up, and what, about a dozen, if we're lucky. But it's a gorgeous evening, so yeah.
We've got a really good video to send out now, haven't we, to promote it? And
hold on, I've not stopped the recording. So we've got that bit there at the end. We'll have to do a bit of editing on that, I think, before we send that out. How do I stop recording? There we go. Stop recording. I have to